Lettuce is extremely poisonous if we eat it the wrong way, and there are 7 groups of people who are extremely dangerous when we eat lettuce. Welcome to the Health Tips channel for the elderly. Do you all think that lettuce is one of the national vegetables that everyone can use well, but in fact it is not necessary? Although rich in vitamins, it is low in calories and is generally considered one of the healthiest foods. But lettuce is not for all seniors. Even if we eat regularly in certain circumstances, then it can also be harmful to our health. So, which groups of people need to be careful when eating lettuce? So today you will find out which 7 groups of people should stay away from lettuce in this video. And please don't click like and subscribe before we get to the main content today. The first group of people are those who have stomach pain and should limit eating raw lettuce. Lettuce contains a lot of insoluble fiber, and it has a cooling effect. It can cause indigestion, bloating, and it will increase the pressure on the stomach if we eat too much. Especially when our stomach is inflamed or ulcerated, eating raw lettuce will easily irritate the stomach lining. It will make this situation worse. At the same time, if you do not wash it thoroughly, it can also be a sensitive reaction to bacteria or chemicals that will remain on the raw vegetable leaves. So if you have a stomach ache, you should limit eating raw lettuce. Instead, you can boil or steam it for better digestion. The second group of people are people with kidney problems, so they should limit eating lettuce. Lettuce contains a fairly high amount of potassium. While people with kidney disease have impaired kidney function, their ability to excrete potassium will be limited. It will cause more potassium to accumulate in the blood. This condition can easily cause arrhythmia, numbness in the limbs, fatigue, and can even be life-threatening if not controlled promptly. In addition, when you consume a lot of lettuce, it can also increase the burden on your kidneys during the blood filtration process. Therefore, people with kidney disease, especially kidney failure, should limit eating raw lettuce or only eat it in small amounts, should not eat it every day, and should consult a doctor or nutritionist before adding it to the menu. The fourth group of people are those who are taking anticoagulants, so they should also be careful. Lettuce has vitamin K oil. This is one of the important nutrients in the process of blood clotting. However, for people who are taking anticoagulants, such as Wayfaning, the amount of vitamin K in lettuce can reduce the effectiveness of anticoagulants. It will cause an imbalance in the blood clotting process and increase the risk of blood clots forming. At the same time, people who are taking anticoagulants should only eat a certain amount of lettuce in a day and avoid sudden increases or decreases. It is best that you consult your doctor to adjust your diet more appropriately. The fifth group of people are those with weak immune systems and should be careful. People with weakened immune systems, such as the elderly, those with cancer or chronic illnesses, should be careful when eating raw lettuce. Raw vegetables, especially lettuce, can easily be contaminated with bacteria such as E. coli or Salmonella or parasites that live in these vegetables if they are not washed thoroughly. With a weak immune system, the body will have difficulty fighting these agents, which can easily lead to infections, severe diarrhea, or serious complications. At the same time, lettuce is often grown near the soil, which will be in contact with fertilizer and irrigation water, increasing the risk of infection. In addition, those who have weak immune systems should prioritize eating cooked vegetables. If you eat raw vegetables, you need to wash them thoroughly in salt water or choose a reputable source. The sixth group of people are those who are preparing for surgery and should limit. Lettuce, it contains a lot of vitamin K. This is one of the substances that it will be a blood clotting aid, and it can reduce the effectiveness of anticoagulants, and it will again cause difficulty during surgery. In addition, The raw vegetables and lettuce can easily cause bloating and indigestion, and they will be contaminated if we do not wash them thoroughly. Therefore, those of you who are preparing for surgery should limit eating lettuce. Eat foods that are rich in easily digestible protein or cooked foods, and follow the nutritional instructions from your doctor so that your surgery is safe and most effective. The seventh person who should limit eating lettuce is someone with a sensitive digestive system or irritable bowel syndrome. It contains insoluble fiber, which is difficult to break down in the digestive system. Therefore, it can easily cause bloating and abdominal pain in those with sensitive digestive systems or irritable bowel syndrome. At the same time, this vegetable is often used to eat raw. Lettuce also has potential risks that bacteria, if we do not wash it thoroughly, will make our intestines more easily irritated. So you should eat a small amount of this. It's best to boil or steam it to reduce the impact on the digestive system. In addition, if you are experiencing uncomfortable symptoms, you should stop eating immediately and consult a doctor or nutritionist to adjust your diet to a more suitable one. Although we have analyzed 7 groups of people who should be careful eating lettuce, it is undeniable that the benefits of lettuce are as follows. The first benefit of lettuce is that it is an antioxidant. Lettuce is rich in antioxidants like flavonoids and vitamin C. It will eliminate free radicals and increase immunity and protect the body from inflammation and lung cancer, and it will be ring cell cancer. The second benefit is anti-inflammatory. Lettuce has anti-inflammatory properties that will help control inflammation due to its natural biological properties. Due to its natural properties, it will have an effective anti-inflammatory effect. The third benefit is to reduce bad cholesterol. Erat has the effect of reducing bad cholesterol. From there, it will be the first support to prevent cardiovascular disease and stroke. According to animal studies, the fourth benefit of eating lettuce is that it contains many minerals. In lettuce, it has oil minerals such as potassium, magnesium, or iron or calcium. It will help regulate the heart and blood pressure and is an antioxidant. From there, it will support the creation of muscles and metabolism. The fifth benefit of eating lettuce is that it is high in fiber. Lettuce is rich in fiber. It will help you lose weight, control blood sugar, and is good for your digestive system, reducing cholesterol. Every 75 grams of lettuce contains 1.3 grams of beneficial fiber per day. The sixth benefit of eating lettuce is that it contains a lot of folate. Lettuce contains a lot of support, red blood cell development, healthy cells, and it will reduce the risk of birth defects in the brain and spine. Once again, thank you for watching the video, and don't forget to like and subscribe to the channel to watch the next videos.